And hello, hi, it's Kathy here from IMCO, from the International Integrative Maternity Healthcare Organisation, and welcome along to this week's Maternity Natural. Gentlemen, we have today that's going to be telling us some amazing work that is being done. Moffat, please say hello.
Hello, how are you? It's good morning. Thank you very much. Thank you for this opportunity. I'm so excited and so happy to be here this morning.
Well, I think we are very privileged to have you here speaking with us, because the work that you're doing is just a little overview about Moffat. So in 2009, with only $1,000, Moffat started, which is a maternity and medical facility. You'll tell you more about, in about 2 years, brother Fred, and later by an Australian midwife, Vicki, and together they provide affordable care to the woman in Kawangware, a settlement. You'll have to correct my pronunciation maybe on that, taking into consideration that Moffat had no actual academic background in medicine. So this was all fueled with passion. It attracted great attention globally for its better and gentle care. You know, we are talking of what relied on third world, developing world level of medicine. So this is, you're just saving lives. It's about 2021, 2022, Moffat, together with other world maternity experts, and Womb to Thrive, the missing keys to heal yourself and your family, and the planet, which has become an Amazon. So much to unpack here. And well, what we're going to be doing, the process today is we've got a short 6-minute video to introduce himself. Then we're going to play a 6-minute video about the facility, and then he's got a slideshow that he's going to, and it's always wonderful if, I know that a lot of people will watch this after the live event, but those of you that are in the world in your role as a maternity health professional, so feel free to put that into the chat. And of course, if you've got any questions for Moffat, do put that, sure that we get those questions answered. So Moffat, please, and give us a bit more introduction about you before we start to play the video.
Well, thank you very much. I'm so happy to be with you this morning, although it's midnight here in Nairobi. I think it's 9 a.m. in New Zealand, Auckland. So I'm so happy to be here today to share with friends all over the world.
It is for me, and yeah, we have quite a lot of Americans watching as well usually, so that will be in the afternoon for them.
Oh, that's so wonderful. So I'm so happy to be here and to share with you what's happening. I have dedicated the past 10 years to be here at Fremo, to be part of the team that is helping the women from this community and their families to be able to cherish life, nourish out of it, and thrive. And I've been the recipient of it all because my 3 kids have been the result of the care that is practiced here. So I've been the recipient of what I've given out, because the team, what we have given out to the community, I've also received, because my babies, 3 of them, an 11-year-old, a 9-year-old, and a 3-year-old are out of this center. So thank you very much. In the coming hour, I'm going to share with you the little background about the center, and Katie is going to run a small video I made 5 years ago in the middle of the whole process, although even before then, even after then, a lot of stuff has happened here. So we're going to run the video, and then later we run a PowerPoint presentation, and then we can share with the rest of the viewers what they may feel like they want to contribute or to ask.
Fantastic. Okay, so I'll just go and start to share screen.
Okay.
The informal settlements that you find in Nairobi.
We'll just go back to the beginning.
Fremo Medical Center is a center that is established in Kawangware, Nairobi. Kawangware is one of the informal settlements that you find in Nairobi. We aspire to empower women through care. We have seized the opportunity to empower them. We give them the counseling, the enrollment, the treatment, resources, make decisions for their own baby. And there's also a provider with diet when to call in for the care. The essence is to come to the clinic, that passion from the midwife and the doctor to call her in.
My first time mom, so I didn't know much about pregnancy. She told me every step about pregnancy, how am I supposed to feel, how I'm not supposed to feel, every step. Before I knew it, my date was due, and I said, okay, I'll have to go ahead and book to Fremo.
The information involves the safety at home, want to come to the clinic. We all phone them, reminding them if on their appointed day, but we help them to prepare their own birth plan. We advocate for normal births, natural, our birth rate. And when I talk about normal, they're not necessarily medicalization, like it's done in hospitals to intervene if there's any obstetric emergency or the deviation from the normal. And there's also time transfer to a national referral hospital. So our women know in the bathroom they're given love, autonomy to express their labor through the prenatal circles, where we invite these women to come in and share their story and prepare them on how to prepare for birth, when to know when to come to the clinic, when to call in.
Moffat had to send a taxi to pick me from my house because it was late. I don't think I would have gotten a car or anybody to bring me here for delivery of my family. Somebody loved me enough.
Our place provide
Hopefully that video will catch up shortly.
Okay.
Such an amazing story. And the statistics that sorry, the video is just taking a while to load. I think it might be because we're running both a live webinar and a live video. It's on the internet. Yeah, so the stats are quite amazing at Fremo, that there's a 96% normal birth rate, which is phenomenal. Yeah, so we'd like to hear more about that. Can you hear me at the moment, Moffat?
Yes, I'm getting you. It's clear.
Okay, so maybe I'm just wondering if this is going to ever load. So maybe we'll stop sharing and start doing some of the
PowerPoint.
PowerPoint.
Yes, hopefully it.
Oh, the slideshow. Yeah, we might start doing that while we're just waiting for the video. Okay. Oh, that's not really what we're wanting. Sorry for fiddling around with this. Let's try that again. Now I've just closed it down. Oops. Sorry, everybody. Technical issues going on here. Let me just find this again. Moffat, would you like to be talking while I'm just sorting with the technical?
Yeah, it's just okay. Yeah. So I think thank you once more. I think technology sometimes is a challenge, even when you put everything in place. But I can take this opportunity to be sharing that Fremo is a center that is located in Nairobi, in the west part of the city. Fremo is known for its better birth practices. And when we are talking about this, we are looking at the needs of the local women who are coming for care. When I moved to this community, it was really a challenge for people to understand what it's like to have that compassionate care, that loving care, that respective care, that support from the family, especially when this woman is in labor. And this is the needs that we looked up to address. And I am pretty sure and convicted that what we tried to set up earlier on in 2011 has stood up to be the formidable results and outcomes that we all share with compassion with the rest of the world. When you look at what we provide here, it's something that is required for any human person. And one thing we have to look at are the challenges of this population. When you look at the World Bank statistics, they tell you about the poverty levels, especially in third countries, but it gets worse when it comes to places like the informal settlements, and Kawangware is one of those. So in my first slide, I'm introducing the center, Changing the World, Better Birth Practices. Fremo Birth Centre, it's a safe haven for a birthing woman. We envision a world where each woman is nurtured, heard, and valued, and has the information, resources, confidence, and support she requires to achieve the best possible pregnancy, birth, and mothering experience. In such a world, our baby will be born with a fair and equal chance at life and love. So that's our vision. And when I'm saying that, I'm looking at how when some places where a woman is just to give birth and she goes home, but inside her, it's a hole that has been left. To achieve that, we focus on informed job choice. A woman is given information enough, not manipulated, not for our own benefit as providers, but to help her get what she desires as a human being. Compassionate care. We are compassionate. Our caregivers, who are made of the doctors, nurses, and midwives, they are compassionate at their best, right from when the woman is coming to enroll for prenatal care, all throughout the pregnancy process, at birth and postpartum. We ensure that there is safety. It's really remarkable that all these years we have never had any maternal death at the center, and that the neonatal, the mortality rate for neonates is at the lowest. There is privacy and confidentiality. This is ignored in most places. This we ensure that a woman has her own room. She has the confidence, she has that confidentiality that she's left alone to labor with our team, with a midwife and our family. There's dignity and comfort, and we also involve the community support. The entire Kawangware area has a population of 291,565 people. That's the Kenya National Bureau of Statistics in 2019, with an estimated 80,000 people being in informal settlements. It's widely reported that the settlement faces a shortage of critical health wash and social facilities. For a moment, if I expound on this, when you look at the information on this settlement, the biggest challenge is whether this woman who is coming for care is healthy. It can be able to propel herself to a viable pregnancy and a successful birth. And this also gives us a challenge to make sure that our women, when they are coming for care, we address the challenges beforehand. We have to take these women through counseling, even as enrollment takes place, to make sure that we understand what their challenges are and how we can help them to be able to unpack so that they are ready for a wonderful and a beautiful pregnancy they can enjoy, so that they can love their babies and enjoy their pregnancy. So the map on the screen shows the area. That's the map of the facility. Now, Fremo in 2010. So we came to Kawangware. We realized the needs of the community were huge when it comes to maternity. And with little resources, and as Katie mentioned, it was $1,000 US. And we rented a room, we put a few things, and off we started. So that is the center earlier on when we started. Okay, that was motivational, that was passion, that even when resources were challenged, the dreams were valid. We were burning with compassion to make the best of what we have seen, to help our people get the best. So the photo is here is our team. That's Fred, midwife Vicki Chan from Australia, and that's myself on the right. So the three of us sat down and we came with a midwifely model of care in our maternity. And all these envisions on all these pillars that we have were laid in 2012. And from there, we've never looked behind, because I can assure you that as the statistic goes forward, we have seen all that coming to pass. The pillars are gentleness, compassion, safety, confidentiality, community support, social justice. And that's the thing I want to explain, Katie, before we go to another slide. If you look at the community where we are, and in any community, I think when you have those pillars in place, they bring the best in humanity, and in particular, when we are talking of a woman. Things like gentleness. I know how many centers have had women who are coming and running to the center. They want to birth at Fremo because the kind of language that is used, the kind of patronizing that they are given on those centers makes them to run away. The compassion, when you are compassionate, women feel that we think they are so vulnerable that we feel sorry for them. But when you have compassion to them, you not only instill confidence, but they start that assurity that the best is yet to come when they are going through the channel of pregnancy and birth. Safety is ensuring that all the essentials that are required for this woman, including obstetric emergencies, they are in place. And mind you that our team is skilled, trained, and professional medical personnel who are able to identify any deviation to be able to address it before it goes away. Confidentiality. In medical practice, we know confidentiality. In human dignity, we know what confidentiality does. And these women are provided that in the process. Community support, trying to involve the community. And this brings in focus their families, because in many settings, you realize that the women are left to labor, they are alone. The families do not have a stake. Even when they feel, we give them the information to make sure that they are involved to be able to support these women, to be able to arrive at safety and at equal chance of survival. And then the social justice. This is where we address the needs of the women. We make sure that the women are able to be served despite where they're coming from. It doesn't matter whether they have or they have not. So they are all served and are given the same care as human beings. You can go to the next slide. So that's a picture I took in one of the bathrooms. That's the setup of our bathroom. In that room, there's autonomy. The women are given autonomy to express their labor in which whatever position they want to. They are left alone. They are left alone with the midwife and their family. So the confidentiality is around their family who are supporting them emotionally, physically, and whatever encouragement they need. You realize in most centers in our country, once a woman is admitted, the family has to go home. But this one is exceptional because we have recognized the kind of support the family and their loved ones can give to their loved ones. And in this case, we give the partners, the husbands, the first chance. And these women are allowed to bring their own sisters, their mother-in-laws, their mothers. These people, they feel comfortable to support them. And this encourages them and even makes the laboring process much easier and shorter. There's partner support. You can see there's a bathing stool. They can ambulate easily. They have a bathing pole, and there's confidentiality. That's the most beautiful room you can ever find in one of the local maternity centers around in this community. Well, we also have in that the rooms, in the bathrooms, skills are ever present. We have qualified nurses and midwives from admission to documentation to all that. It's a conducive environment that is quiet, that is at peace, that is warm enough so that these women can enjoy as they grow through the laboring process. We have also emergency drugs. So we limit drugs, but in any case, there's a deviation from the normal process, or maybe a woman is bleeding, maybe there's an intervention that needs to be done, or the emergency drugs are ever present. We also materials, and now materials for resource for the midwife, even as they take the women through the care, there's enough library in the room for that. There's autonomy. Women are allowed to take those comfortable positions. If a woman feels like standing, seated, going on a bathing stool, all that are present. We also provide them with drinking. So when a woman is admitted, we provide drinks for them to be drinking. It can be tea, it can be hot water, it can be local porridge, all that is available. We also encourage eating light meals even as the labor processes. There's dignity and there's one mother at a time. And when I'm talking about one mother at a time, I mean every mother who is admitted, she's at the center of the care as she goes through the laboring process. Sometimes we can have up 3 women in labor, and all of them, each one is treated individually, focused on our laboring process. Next slide. So during our birth, we practice what we call delayed cord clamping. And this one happens when we have to make sure the baby is born, the cord is clamped. And when it stops pulsating, and when we ensure that all the blood that was in the placenta has passed to the baby, there is skin to skin bonding immediately after birth. So once the midwife has delivered the baby, they wipe them with dry towels. They put on the skin of the mother as the whole process goes on. There is also initiated breastfeeding immediately after birth. Even when milk is not coming, the midwife ensures that the nibbles are put to the mouth of the baby, so that as the hormones go on and the process goes on, we make sure that breastfeeding has been initiated. And mind you, we have 100% exclusive breastfeeding until 6 months for all the women born here at the center. So referral and transfer, the 4%, we, as Katie said earlier on, our normal birth rate is 96%. So the 4% are the women we refer because of one reason or the other. And our hospital of referral is the National Referral Hospital, Kenyatta. So all mothers requiring are taken to the National Referral Hospital, and all referrals are all timely. So we have this arrangement when we feel like the care needs further intervention. We call the other hospital. We have a good relation with this National Referral Hospital. We inform them of the progress of the mother, and we ask them that we need to transfer. So the midwife and the support team and the family to get to the van, and they take this mother to the other side where she is received by the referral hospital. All documentation are handed to the referral hospital, and we get a feedback after the mother has been assisted. Mother, family, and midwife are involved. There's always a van, a standby when we need to transfer these mothers. So we have what we call prenatal care circles. In the photo, you are seeing expectant women seated in circles with midwives and with peanuts and birthing poles. So every Wednesday afternoon at the Kawangware Center, over the years, we invite women to come here in an informal group setting. These women sit in a circle, sharing stories with the midwife, asking questions, and even bringing their cultural experiences to others. So we look at the needs of these women. We also learn what's expected of us when these women are coming into labor. They also learn from us those myths and misconceptions that does not apply. So this circle have elevated our outcomes to be at the best, because these women, even as they come for the care, we understand them. We are we know them, we know their needs. And in the process, when these women are coming for care, they feel they're at home, they are informed of who they are going to get. They have done all these exercises and they learn what the center is like, so that when they are coming, they are not coming as strangers, but they are coming home to give birth. So it's more of a home birth when they are coming for care. So next slide. So as the next slide comes, so there's also what we call a midwife outreach program. And this one, I think it's only done in our center. Over the years, we have followed all our women to their living rooms after discharge. So when a woman is discharged from Fremo, the midwife follows her in her living room 24 to 48 hours. So here she goes to check how the mother is faring after discharge from the center. She does a postnatal checkup for the mother, doing all the vitals, going through the discharge summary that was given by the doctors on discharge, ensuring the mother is well acquainted and she's going to follow all the instructions as indicated in the paper. And if maybe she cannot be able to read, the midwife at home, she's able to explain practically what the doctor meant and what is expected of her. Our baby is also checked to see if the baby is taken care of, the environment is clean, the cord is well cleaned, and the other vitals, including the temperatures, are okay. In fact, the reason why even the neonatal mortalities are very at lowest is out of this midwife outreach. Remember, it's very, very critical for our baby between the days of 0 to 28 days. This is when some of the kids lost their lives. And therefore, when this midwife goes home, she will find some other challenges like the baby is having a temperature, maybe they have developed infections. Remember, being in informal settlements, challenges of infections are high. And in the process, the midwife can bring this. She has a bag that carries drugs, and together with the doctor at the center on duty, they liaise very well to be able to know exactly what kind of treatment or medication this baby needs. If they feel like the baby needs further testing, maybe they need to do some blood running at the laboratory, they are brought back at the center. And for the mothers, the same is done. The mother is checked whether she's coping very well, breastfeeding is done well, she's doing, if she had maybe perinatal during birth, she's taking care of that part very well, and taking other vitals like blood pressure and other signs, like maybe if she lost some blood, if maybe she's developing some kind of anemia. And remember, some cases, this midwife also realizes that some women have challenges at home, and in the process, some may need support, and she can come back and say she feels that woman needs to be supported from the center in terms of food and other foodstuffs. So this one has really improved the care by making sure that the care does not end up at birth, but the postpartum is also very important for these women and their babies to survive. And these babies are followed all the way until they reach 2 years. So we have what we call child welfare clinics. Apart from the postnatal outreach program, these babies are supposed to come to the clinic regularly for those ones who need immunization. They are checked by the team for proper growth and development. They also follow them for other things like how they are breastfeeding, if the milk is enough. Also, there are those babies at some point as they grow, you realize because of the challenges of the mothers and their families and the environment, they may have developed some malnutrition. We have qualified nutritionists who goes through this and provide them the baby supplements to ensure that they catch up with the proper growth and development. There's also nutritional counseling for both mothers and how they'll take their babies. As I had said, that there's exclusive breastfeeding up to 6 months. And therefore, when weaning comes in, and remember, for any midwife or doctors can tell you that when this baby starts weaning, it's a big challenge, and their mothers need more information how to initiate weaning. So our clinics, the child welfare clinics, plays a vital role in ensuring that the mothers have gotten enough information how to start practicing this, so that they don't bring about challenges to their kids. So there's what we call Mother's Day. You can see from the photo, these are very happy mothers who have gone through prenatal care at Fremo, who have gone through perinatal care at Fremo, who have been visited at home, and they're coming back to the center with their bundles. We call regularly mothers to come back to the clinic. They need to share with the team. They need to celebrate with the team. We want to know how the care was, what their needs achieved. What can we do better next time? What were the biggest challenges? So there's a gratitude and thanksgiving at the center. And I believe for any other human being to see you mothers with their beautiful kids and smiling and happy to have reached where they wanted to be is the best you'll ever want for any human being. It's also a scorecard that what have we done? Did we reach the promise? Did we give them what they deserved, they desired? Did we reach their preferences? The staff and families bonding. We did this quarterly, and there's a celebration as we take drinks and foods together with them. Next slide. So as the next slide comes, there's continuous medical education. I think for our care to be where it is, there has to be continuous training for our staff. Caregivers at the center are qualified medical, compassionate, trained staff. They include medical officers, clinical officers, midwives, and nurses. So we have set every Wednesday morning to be a time for coming and sharing. So we go through the notes. It's continuous learning. We check on the latest in the world of maternity. We also look at what has happened in the rooms. And if we had a case scenario that needs further consultation and agreeing, we are able to share and see how we can do better next time. So every Wednesday, apart from maybe even some days when we have a mother in labor, some of the midwife and the staff can be assigned to these women, as the rest of the staff who probably meet the quorum can be able to discuss, so that we keep on learning, we keep on reminding ourselves, we keep on seeing if there's any mistake that maybe has been identified in the process of caring for these mothers and their families. So we are also wretches. We are recognized by the government, we are licensed by government, and we are supervised by the government. So we are under close supervision and monitoring from the government. And when I say close, it's not that they are patronizing or they want to say we are doing something wrong. They come to supervise us, making sure that we are meeting the standards of operation, including how we document our charts for mothers in labor, how we document all the registers as required, and we are able to submit to them the reports of our care to their offices. Though there's also monthly maternity reports that are submitted to the local government. So every care that we give, the government is aware of our practices. So they're also here to see if we are also following the guidelines and policies that are for the better care for our clients and patients at the center. So community support. As you have seen earlier on, I was able to provide you a map of our locality. So Fremo does not exist on its own. We are an open organization. We feel that we are part of the community. For us to have achieved those statistical outcomes, we are so happy that we serve members of our communities and they embrace the care that we keep sharing with them. We also understand that information is critical in providing maternal and medical care. We aspire, and we have created good relations, and we aspire always to keep it at the best. We are also involved in empowering communities in the process of going to their homes, trying to see the women who have challenges. Even when we try to feed them during the postpartum period, it's our responsibility to see how we can empower them so that they can sustain themselves and move on to take care of their families after birth. We are involving in every step of the way for a pregnant mother and her family. We also challenge them on how to go through parenthood and parenting. We also encourage them on how to take care of the kids, more especially in this environment that has challenges of issues like insecurity, drug, and other challenges you can find in informal settlements. Also, we identify that respecting their individual culture, the culture of values, is one way of giving a human being that dignity. So we also recognize the need of volunteer. Fremo is open to volunteers, and you realize the kind of care we provide and the challenges of resources. We also invite volunteers to come at the center to share with us. So the center has a lot to offer for those who seek better way to practice, more especially the midwife. We also provide a place for students for placement. I know there are student midwives who feel like there are some hospitals they cannot practice because they cannot feel comfortable and safe to see natural and normal births. Fremo is a place for you to travel and have this experience. We also invite general volunteers so they can come here because you see we are a low risk center, and remember that there are challenges of economy, because I think having to support these people, it requires resources. So when the general volunteers, they can come and clean, they can come and cook, they can do paperwork. So they can do even laundry. So for other midwives, they can also bring skills. They can come from their way of practice. They can come and share how their care of normal and natural births is done in their countries and also their localities. We can also share culture. Remember, we have come a local neighborhood with the globalization. So how good is it when we travel as people are doing the same calling to share our cultural in terms of maternal care and other areas of lives. At Fremo, they can gain, the volunteers, especially the midwife, they can gain hands-on midwifery, non-pharmacological birth, outreach work in slums, rich life experience like no other, advanced communication skills, normal birth including challenging birth, and rich culture. So Fremo is a low risk and a low resource center. Sometimes the needs of the clinics are very high. Remember, we don't depend on direct donations, but maybe if somebody sends one donation or a midwife comes, that's when we depend. We also ask for the people who are willing to support the center. Like the other day, our ambulance was involved in a fatal accident, and therefore right now we are really having a challenge in trying to have our referrals. So if people of goodwill and well-wishers and other midwives from wherever they can support the center in any way, our information is on the slides. And mind you, all the donation go 100% to support the center. And I think that's my simple presentation for today. Katie, I thank you very much. And now we can go back to interaction with our viewers.
Oh, that was absolutely wonderful. Thank you so much. What you're doing there, Moffat, is just extraordinary. Immensely proud of the results. Just amazing. You know, that incredibly, basically, I find it very interesting that your pregnant woman are basically attending a weekly, circle, prenatal circle. So that's throughout their whole pregnancy. And what an amazing head, her mind into when she is coming into birth, that she's had months to hear stories about labor and about birth, and that whole thing becomes so familiar. And I think they have, and particularly in some countries, the education that women receive, education, you know, is so limited. They're not feeling empowered by the time that they are ready, you know, to go into labor. You know, when all you've done is one weekend course, you know, half Saturday, one half Sunday or something in the course of the whole pregnancy, that's just, I passionately feel that the fact that you're doing this every week with the woman, it's amazing. The confidence that you would 10 weeks pregnant to when they're 40 weeks pregnant, that information that we received for over 30 weeks or so, support structure that they would have from the staff. They're so familiar, from all the other women there. They've created friendships. Just amazing. Your comments that it's one of the very few births that the partner and family can attend the birth. That's kind of shocking, I think, in a way, are not able to have that, because research is very sound on that, isn't it? That we know attending there and looking after your needs and having the partner present and experiencing that, the enormity of labor and seeing their baby, huge difference for the woman's labor, her length of labor, the bonding with the partner. So many women, that you're so rare, that you allow that to be occurring. I know that different are allowed in a birthing room, and certainly it's quite common around the world that there's a limit. In New Zealand, there happens to be no limit. So a woman is entitled to have however many people she wants in the room. I have been in situations where we've had more than 20 people in the room.
Overcrowded.
And it's a whole big community, and you can hardly get around everybody to get to do your
Yes.
job. So it's so wonderful that you're standing out. The weekday, every Wednesday, staff education. Wow, and the modern, you know, westernized world that could learn from that and just make that part, you know, they're certainly not weekly. And wow, I can imagine how not just the education, things could have been handled differently, but just the camaraderie between the staff, relations must, you know, that just must be wonderful, instead of situations where staff may be attending an education, you know, 2 or 3 times a year, and could be in a room with people they're not necessarily using. Amazing. So we can all learn a lot from you.
Thank you.
That's for sure. So I just want to see if any of those are questions that we need to go through. Yeah. Oh, so that somebody asked a question: if 3 women give birth at the same time, do they each have their own midwife? I would imagine that would come down to your staffing and who might be laboring at 2 or 3 centimeters or 5 centimeters.
Okay. Yes. Thank you very much. I think
who's actually got a baby.
Okay, that's a good question. Thank you for asking. I think we have times where we have had 3 women coming into labor, but the biggest challenge we have had is when the public, like the government side, is on strike. So this is the most difficult thing, and it gives our staff a big challenge. So even when the resources are stay, I can only say that we have the best team ever. And as a leader, I feel like our staff have just made it possible, because we could not have had all this conversation, all these outcomes, this center without this team. And they are overworked. Sometimes that's why we feel like sometimes we need volunteers. But because of the compassion they have at hand, because like tonight, the 2 centers have 3 staffs on duty. So we always have to make sure that we have enough staff in eventuality. So we have enough rooms. We have 3 rooms for the care. So if the women even come and go in labor, each room is assured of having a midwife. And even if the midwife is, their midwives are not, and most of them are within. If we have some emergencies, our staffs as compassionate, they can be on call any minute. So if we are understaffed on a particular time, the midwives of duty are on call and they can arrive immediately.
Wow, that is so fantastic. Look, there's so many lovely comments here, and thank you for those who are putting out your comments. You know, look, it's what you're doing is,
thank you,
just extraordinary. So thank you. Well, I'm reading out some of this excellent work that has motivated us in a community at large. You again, that's from Henrietta. A super insightful and touching presentation. Great work going on, Fremo. So exciting to see you are reaching out to so many people. So more people in that informal setting. Congratulations, wonderful presentation. And the women are not only that they are blessed. It's so true, so true. Yeah, so look, we are running out of time, and I think that we could spend hours listening to your wisdom and on the ground. But is there anything else that you would like to add before we conclude, Moffat?
Okay, well, so what I can say, I think last year I worked with a team of experts to write a book, The Womb to Thrive, and in that book I gave an insight of what is happening at Fremo. And for the last 3 weeks, we have been going through this conference and been sharing what's happening at the center. And I can say that this care has been impressed by people of all walks of life. And I see one of the comments from Rona. She's saying, Fremo is indeed a blessing to many women, not only in Kawangware. We have had women crossing all over from neighborhoods to come at the center and give birth. So it's not been limited to Kawangware only. And I've seen women coming from far distances, very far neighborhood to come and visit the center. So we are on the move, but also we'd love to feel like this is the best care we have done to humanity. And we invite, Fremo is a challenge when it comes to supporting these women. But even with these challenges of resources and in any aspect, we've never compromised. We have never compromised our care. And therefore, I want to ask people of well wishes who will come, who want to volunteer. You can reach us, or you can reach the Midwife program. You can also, if you want to get support to Fremo, you can support a midwife, you can support a birthing woman. You maybe somebody wants to support a doctor or a midwife who want to do a short courses, we are always open. But also if you feel like you can donate resources like birthing essentials, it can be sent to Fremo so that we can keep this work going on. So we aspire to have our own land and put our own a building where we can aspire to improve this care and share to other areas in the world of the model of care we have laid here in Nairobi, Kenya.
I have just put onto the chat there for everybody the link to that video.
Okay.
Which we didn't manage to watch, 5 minutes long, and it's or 6 minutes long, and it's wonderful. And look, great to know that you is. So if somebody wants to have an experience of a lifetime and supporting the amazing work that you're doing. So look, thank you so much, Moffat. It's been yeah, hats off to you. We're all in admiration at the incredible difference that you are making, you know, in that coalface, so to speak. And it's just incredible. You're an amazing dude.
Thank you very much. Thank you. And next time you have a chance, I can bring our...
We're honored to have met you. We have spent time with you today.
Oh, thank you so much. And anytime you feel like I can next time, if there's opportunity, I can bring the midwife and the doctor, and we can always share, and maybe we can ask questions and they can share what happens in the rooms. Thank you very much.
That would be amazing. Yeah, here today. And we thank you for your time being live, and thank you for those who are watching it later on. And we just thank you again, Moffat. Good night. We'll say good night to Moffat.
Thank you very much, Santi.
It seems quite late there.